Science at IMSH 2014, representing HealthySimulation.com. We're standing here with Stuart from Metaphor, and they're launching for the first time in the United States the ScanTrainer. So, Stuart, tell me a little bit about Metaphor, what they've been doing in the UK over there, and what they're doing here now in the US.
Okay, well, Metaphor launched out of Cardiff University Medical School, and we created an ultrasound simulation product that's designed to take the key learning skills so that you can teach any doctor in any environment how to do all the complicated bits of an ultrasound skill.
Okay.
And the reason we did it was that basically there's a global problem about ultrasound training. There's not enough patients to learn on, and there's not enough doctors to teach them.
Right.
And so what we've done is combine this together to give you a virtual reality-based training system that means in the non-clinical environment you can learn all the ultrasound skills, but you're doing it using real scans. And I think that's the big difference in our product. We take a real patient scan, we rebuild it, and we put it into our simulator. Wow. And then you get real feedback on this virtual person. As you're scanning that virtual person, you see the image on screen exactly the same as if you're scanning on a real ultrasound machine. So it's not simulated at all, it's a real image. And then we build a lesson around big noise there. We build the lesson around the curriculum-based learning. So you break everything down into nice, easy assignments and tasks. You sit on that trainer and you learn. You're scanning, the system's telling you what to do, showing you videos how to do it, giving you, and then importantly, gives you feedback on how well you've done. Right. So that's a really important part of the learning process. Is if you imagine, if I was having you teach me as an expert, you would be actually saying, no, rotate your hand to bring the image into view, and then you point to the ultrasound machine and say, look, there's the structure appearing. Well, our system does that. So as you're scanning, if you're struggling to understand how to acquire the image, you activate the Scan Tutor button. It then brings up color guidance system that shows exactly where the structure is, real-time live in color on the live image. It guides your hand by showing exactly where you should be scanning, the position on the body, where you should be scanning, and the actual orientation position. And then when you've finished, it gives you feedback on how you've done. It measures every single thing you've done in real time, showing you position, pressure, probe, whether you've measured anything correctly, got your alignment correct, so that you can sit down and then they find out whether you've scanned to a proper clinical level.
Does it record the material that you're going through so that the debriefing process we could go back to certain
Absolutely.
points?
So everything's recorded. Any tutor at any point can go in and see what any of their trainees have done, and they can replay the lesson and see the trainee scanning in real time.
So I'm noticing this a very interesting haptics looking device here on the ground. We kind of took a little test of it, but when we move around, is it going to give me feedback so that it feels like I'm actually touching on the body? And it
Absolutely,
does.
yeah.
So it's actually feeling right now like I'm pushing down onto a body, and that there's tension pushing back onto me as I kind of move the probe up and down, and that's a very interesting kind of feeling. So that it can really kind of mimic, like you said, I've gone down to the side of the body there, exactly what's happening with those scans. So we could take very different sized patients.
Absolutely,
from pediatric to geriatric and everything in between, and scan those images and then experience the differences, say, in those experiences through the device, through ScanTrainer.
So we program the patient into the simulator. So as you say, if you start as a 12-week pregnancy, then you go to 20-week pregnancy, and then you're a 27-week pregnancy. The whole time the belly's changing in size and in feel, and we program that into the simulator, and you then see, you feel that, but B, you then see everything about the scan changing.
Right, and some of the other ultrasound trainers that are out there, there's one body form that you're working with.
One mannequin, yeah.
And so this enables the similar types of training, but to go beyond in terms of adding different kinds of case scenarios to deal with different types of patients in terms of those bodies. Absolutely.
So you get a whole variety of patients on there. And I think interestingly, when you look at a mannequin, you think, okay, there's the body, it feels real. But actually, when you're scanning, you're looking at the ultrasound machine, your hand's just resting on the patient, in this case on the abdomen. And when we ran studies with doctors and told them to put the probe on a mannequin and then use our probe, but actually look at the image, they felt this was absolutely the same reality, because
they're not paying attention to what's going on.
Absolutely,
they're just looking at the screen.
And the feel when you turn away and your hand's on the patient and you're looking at the probe is that actually that feels right. It's got the right bounce. If I hit a rib, it grinds against the rib. Everything about it is trying to make it as real as possible. And I think From our perspective, that's the key. It's all about realism. If you're teaching a doctor something, do they want to look at something simulated or do they want to look at something real?
Yeah.
Well, it'd be best to be as real as possible and be as close to being a one-to-one with an expert as possible. And that's where we're trying to position our product.
So this is the first time that we've seen this in the States, and so now you guys, from what I understand, you've launched a division for the United States.
We have, yes. So we came out of the UK. We said, look, if we can't sell it in the UK, why should we be able to sell it in America? So we're in about just over 60 hospitals in the UK, which is a big part of the market.
Yes.
The equivalent in America would be to be in over 600 hospitals.
Right.
So based on that success, we said, let's start in America. So we started last year selling direct from the UK, but we literally just this month started Metaphor North America. We've got a team of 3 guys and girls here, ladies here, and we're here at 2014 and we're saying, come and see us. This is a new product, you'll love it.
Absolutely. Well, where can folks check out and learn more about it if they're interested from HealthySim?
Okay, they can go on our website, which is metaphor.com. They can contact any one of the guys, and what we do is we bring the system into the hospital, we set it up for the day, anyone can come and look at it, use it. We think our system will stand up against any other product.
Sure.
Come and try it, we'll bring it to your hospital, and then we can talk further.
So great, if you're interested in a demo, you guys can check it out more at metaphor.com, and obviously we'll provide the links to you below. So thanks so much.
Yeah, thanks very
Really
much. Nice to meet you. Okay, thanks.